My name is Val Jenkins, and we're here today to bring awareness to Chiari Malformation. Um, I have several guests here, and we will be having a roundtable open discussion on what we experienced in these few years. So today, I want to introduce our first guest.
Hello, I'm Dr. Richard Bruno.
I'm Sabrina Allison.
Kelly Jenkins Bay.
Malcolm Coffin.
JJ DeGraff.
Great. So I asked each person to come today because I met each one of you via the internet, via Facebook. I met Dr. Bruno in person, and I noticed that we all have the same disease. Some of us have several diseases that's basically related to this disease, and we just want to bring awareness. I know that there's a lot of people, it's a very, very, very rare disease, but I strongly believe that it's more people in Baltimore and it's more people in the world that have the same disease. And once they see this video, then maybe a light bulb will go off. Wow, I deal with this, or I suffer with this, or I had this problem, or the doctor said that. So, Dr. Bruno, you want to explain a little bit what Chiari malformation is?
Sure, Val. Yeah, definitely. So, Arnold Chiari malformation is a Chiari malformation type 2. And basically what's happened is it's a condition that you're born with. And you can think about it, it's a hernia of the brain. Now you can think about hernia as like, you can have a hernia of your belly button, you can have a hernia in your groin. A hernia is basically when a part of your body comes out through a hole that it's not supposed to. Okay, so for example, if your belly button has a hernia, sometimes little babies get this, part of your intestine kind of pops out through your belly button, right? So what happens with your brain is your brain is two different parts of your brain. There's the cerebellum, which is kind of in the back that helps with your motor coordination, and there's the cerebrum, that's the main part of your brain. The cerebellum has really kind of come down through the hole at the base of your brain where your spinal cord comes out. So you have the cerebellum and it's kind of coming out of that hole a little bit. It's kind of popping through there. And that puts compression on your brain stem. It puts compression on your cerebellum. And it could put compression on some of the nerves that come off your brain, your cranial nerves. So this can cause a whole host of different symptoms. And we're going to talk a lot about those symptoms today because you guys have lived through these symptoms. And they're very, very important to recognize because I think one of the things that you're going to be hearing about today is that it's not a clear-cut disease. Okay. There's a lot of different factors. And so what I hope if your listeners are tuning in, maybe they're here and they have something that is similar and maybe has some symptoms here and there. And if you can put a whole picture together and get to a physician who can take a look at you and talk through these, maybe you can get some answers for your life. And so I think we're going to talk about what it's going to look like to have these symptoms popping up, what it's going to take to diagnose this Chiari malformation, and what some of the treatments are to really help people out who are really struggling.
Okay, thank you. So, like I stated earlier, that each one of us was diagnosed with this disease, and we have a chat group where instead of us running to the doctors every time we have a symptom or a flare up, we go to the chat group and we talk about it and we discuss it. With me, myself, I am so reliable on Google because if I have a symptom, I Google it first to see, or I reach out to you ladies and you gentlemen, to see if it's related to this disease. Because I'm basically, from October 2013, they basically just waved the white flag to me and was like, it's nothing more we could do for you. So, only time now I go to the doctors is because I have a whole new symptom or a whole new issue that came up and I want it in my hospital records. So if I don't go to the doctors and God forbid something happened major in a year, it's my word against the Social Security word that I do have these issues. Right. So that's basically the only reason why I go to the doctors. I met Sabrina on Facebook, and can you tell us some of your symptoms?
Some of my major symptoms are the major migraine headaches that I have, the vision changes that I have. I notice sometimes that my speech changes. I've had a seizure before. My balance and the vertigo But the major issue, I would say, out of anything and everything, would be definitely the migraine headaches, because after years and years of treatment, only up until maybe about a year ago was I given medication that worked on a consistent basis. But other things that I have noticed is joint pain, the chronic pain depending on the weather. These are things that I may have had before, but I just did not know what it was or could not relate it to anything. But now that I'm aware, I relate more things to the Chiari malformation, and I pay attention to more of the things that are going on with me. The unfortunate thing is, as a nurse as well as a patient, getting a doctor to look at you and listen to what you're saying and not what they want to hear.
And I'm sorry to cut you off. Yeah.
Because anything can be textbook, but when you have someone that presents and it's not textbook, just because it's not textbook, listen to what I am telling you, not what you want me to have. Don't give me what you want me to have. Treat me based on what I am telling you. And that is the most frustrating thing, that sometimes you cannot get a healthcare provider that is willing to listen to you based on what you have. Because even though it may be all in our heads, it's not all in our heads. And we're trying to explain something invisible to people that don't understand what is truly visible and real for us, but it's invisible to people that are around us. And if you don't live it and you don't try to understand it,
you would not understand it.
You won't understand it.
And you're the only person out of the group, out of the 5 of us, who have not had the surgery.
Right, I'm the only person that has not had the surgery.
So Kelly, when were you diagnosed?
I was diagnosed January 2008. I was 11 weeks pregnant, and I got a migraine that lasted about 3 weeks. And I lost, about 17 pounds within those 3 weeks. So they took me into the hospital, admitted me, and the neurologist basically asked me what my symptoms were. But at that time, it was the migraine headaches. But I also noticed when I coughed or laughed really hard, at the base of my head, it would freeze. And I kind of related to like a brain freeze. That's what it felt like. And before he did the MRI, he diagnosed me. This is what you have. But the MRI confirmed it. And basically, I've been living with the severe migraines where I'm hospitalized at least 3 to 4 times a year.
Wow.
Because I cannot, no medicine fixes it.
Wow.
And I haven't been on medication for about a year now because nothing works. Some of my other symptoms are I have problems swallowing.
Yes.
Not just eating, but just sitting here and swallowing, I will get choked up. I have severe insomnia, nerve pain in my shoulders, arms, and a whole plethora of other, things that I go through. Yeah.
Right.
It's really bad.
So Malcolm, someone tagged me with you, and you are the very first male that I ever met with this disease. How long have you been diagnosed, and what was your symptoms?
All right, I probably got diagnosed in, I'm gonna say 2004, 2005. But I started feeling the symptoms when I was like 13. So before that, I think what happened was I was playing with my brother, and I fell awkwardly, and then from that point on, I lost feeling in my chest from my right side.
Wow.
So my chest
Wow.
and my arm just lost complete. I couldn't tell hot and cold water. My pain threshold kind of went up, but there's always a gift and a curse to that, because it felt like my arm, like certain joints would be on fire. So it was on fire under your skin, but you really couldn't, there was really nothing you could do about it. Like sometimes I would just rub in certain areas just to kind of, make it subside. But I played sports, I worked through it. I didn't really have migraines per se a lot. Like I would get them when it was something that I drank or something that I ate that just didn't agree with me, it would cause some type of inflammation
Right.
or just
I used to say all the time on Facebook, I feel like fire shut up in my bones. And everyone thought I was quoting a church scripture. Literally, I felt like I was burning on the inside. So, after your surgery.
So, I'll say this. I was diagnosed in 2005, but I didn't have the surgery.
And
until
let me cut
2000.
you off for 1 second, and I apologize. We won't be using any hospitals or doctor's name.
Okay.
You came in a little later.
Oh, that's cool. Well, I was diagnosed in 2005, but I didn't have the surgery until 2009.
Wow.
It was just one of those things with work. You know, your work situation wouldn't allow you to stay off a certain amount of time. And so you didn't really get the support from that end. And then because it was considered a pre-existing condition, you know, during that time, you didn't have that type of medical support. And so I pretty much had to wait until I got with a company that actually, when I told them about it, they actually supported me and, you know, and encouraged me to go get it done. And so once I got it done, I still have numbness in my arm. Like this, it's just never gonna come back. Basically, that's what he said.
Wow.
But I stopped taking the medicine. They prescribed me the Lyrica. I couldn't take that. Like that makes me highly aggressive, and I just didn't. I'm a very calm person, so for me to take that, it was definitely took me out of I was another person.
Yeah.
Wow.
And so I couldn't take that. So, you know, I deal with it. I deal with the pain as I can. I don't have, after the surgery, I haven't had as much pain, but I knew before I had the surgery, and the reason why I did eventually have it is because I could feel it spreading to my left side.
And that's the thing that I was saying, explaining the invisible
Bulls.
to someone that does not understand it, because that may be something that's on the inside that he's feeling,
Feeling that you can't
and he can't explain exactly what is
he's
going on, but it's real to him and it's real to us. But trying to explain to someone exactly what you're feeling and what you're going through, and trying to get them to understand it, that is the hardest part about getting treatment. Because they'll say, well, okay, you know, you're feeling this or you're feeling that, well, let's just do this. But it's so much more, because it's connected to so much more than just the shoulder pain.
Right, exactly. Or the head.
Or right.
It's not just in your head, it's in your head.
Right. It's connected to so much more, and that's the invisible part, because we don't look like what we're going through.
Exactly.
And people don't understand that, okay, 5 minutes ago I was perfectly fine, but for some odd reason a light switch came on, a wind blew, anything could happen, and something just happens out of the blue.
Right.
And people don't understand how in a split second everything changes, and we don't understand it because we don't always know our triggers.
Exactly. So before we get any further with that, we want to introduce Jen. Again, Jen is someone that we met. Well, actually, we didn't meet. We met on Facebook, but Jen and Kelly, both, and Crystal, I wish she was able to make it, they all three work with my daughter. And when I was diagnosed and my daughter had to take so much time off of work, she was like, oh my goodness, you're not going to believe this. My co-workers have this disease too. So Jen, how long have you had it? And it seemed, not to compare, but it seemed like you and I had the most problems out of this.
Yeah, I don't know. It's kind of all relative. It's interesting because everybody's Chiari experience is so different.
Right.
And yet so much the same. Like as we're sitting here talking, I'm like, oh, yep, I got the arm.
Yeah.
Mine's on fire right now. So it's kind of crazy. It's hard to compare that. But so I've had it my whole life, like you guys. Just didn't know it. I had symptoms my whole life. As a child, I was in and out of hospitals and doctors. My poor parents, like, something's wrong with this kid, and nobody knew what. Everything from like bladder and constipation issues to the severe headaches, which it's like, oh, maybe it's puberty, maybe it's this, and nobody knew. Vision issues, balance. I have no balance. It's terrible. So I actually fell and hit my head in 2004. And within 6 months, I guess it accelerated. It pushed my brain back because I landed right here on my head, blacked out and everything. I went to get a soda out of the fridge, and I was like, "Man, this fridge is broken. This soda's hot." And I put it in this hand, and it was cold. And I said, "Something's not right here."
Wow. Say that again. Say that again for the people, because that is major.
Yeah.
That's major.
I picked up a can of soda, and I thought the refrigerator was broken because it felt warm, like it didn't feel cold. And when I put it in this hand, it was cold. And when I put it back and forth, I could not feel any temperature in this hand. Ran my hand under hot water, could not feel it. But like he was saying, my arm is on fire. That's
joints, why you have the pillar right there.
Yeah. So it's on fire. It comes from here. It feels like it is being. Sometimes it feels like it's being crushed.
Yeah.
Like every joint is on fire. It feels swollen. Rubbing it, like the hardest I can rub it, and you cannot rub my arm hard enough to make it feel better. Which is probably also not good for it. But so I had numbness and tingling in the arm. I started having it in my leg. The hospital I went to told me I had a separated or something with my shoulder, which was not it. So I started seeing a chiropractor, and the third time I saw him was right after the soda thing. And I said, "You know, when I leave here, I feel great. I'm not numb. I'm not tingling. I can feel things. But now I have like temperature loss, and then the numbness comes back." And he was like, "Yeah, I'm not going to touch you again until you have an MRI." And thank God he took the time to send me for that, because when I went back, he had he was lucky enough to get to tell me I had Chiari Malformation and syringomyelia, which is basically like a cyst in the spine, which was caused from the brain sitting on the spinal. Sitting out of that hole that Dr. Bruno was talking about, and causing the compression, and so it was slowing my spinal fluid, which was essentially paralyzing me, which is why I was losing all of my feeling in my arm and my leg, and then insurance denied me for pre-existing condition. The first neurosurgeon I saw was absolutely awful. He refused to work with me, didn't want to talk about payment options or anything, which that ended up being good because I saw another doctor. I was living in Virginia at the time. His nurse said, "He's really busy. He has a 6-month waiting list." And I said, "Well, I'll be dead before then. So, you got to figure something out." I was at the point where if I even turned my head so much as this, it radiated across my head, down my neck, into my face. If I coughed, laughed, anything, that I was on my knees crying. Couldn't bend down. It was, the littlest movement, I couldn't put a shirt on. And so I drove up from Virginia, handed her my scans. Before I even got home, she called me. He had looked at my scans in the hallway between surgeries, and he said she needs surgery immediately, or she will be paralyzed within 6 months.
Wow.
Because that's how much my spinal fluid wasn't moving, and he could see how bad it was. So since the surgery, I still get the headaches. The arm's never going to get better. The leg's never going to get better. Still have a lot of symptoms, but I am one of the lucky ones that I've had one surgery. I've had a much reduction in my frequency and intensity of my headaches, but that is not the case for many Chiari people. People with Chiari, rather. Some of them have to have multiple surgeries. Some of them it never gets better. So while I live with pain daily, and it's awful, and you can't see it, and right now I'm sitting here like it took every ounce of me to get ready. It took me 4 hours to get ready to come here today.
And you said something earlier in our chat on the timing, because everyone who know me know I'm never on time for anything. And it's not that I know being late is disrespectful, no matter how you look at it. Like I could be to work anywhere between 5 a.m. and 9 a.m. and I still get to work late. But in my mind, I'm trying to do the best I can, but it seemed like I can't focus on one thing. So I go downstairs to iron my clothes, and then I put the iron out, and I realize I'm upstairs doing this, and I realize I never ironed my clothes, and it's like no matter how hard, even ironing my clothes, I still can't focus enough to get where I'm supposed to be at on time. And it's not that I don't care.
Right.
I give
So-
you an example. I ain't even cut you off.
Go ahead.
I went inside the house. I had started my car this morning on my way here, and I went inside the house like 5 times before I even left the house.
Mm-hmm.
So went in the house, came out, locked the door, sat in the car. Oh man,
Wow.
got this. But back in the house, came back out, locked the door.
It's a short-term memory too.
Yeah, so it's like,
Yeah.
and I really started experiencing that probably before my surgery, and I just chalked it up as, you know, yeah, I just forgot.
Yeah.
And that's what brought us together. So each one of y'all shared a little point of what y'all going through. Who's thinking? So each one of y'all shared a little point of what y'all went through. In my experience, I was sick my whole entire life. Unfortunately, no one believed all I was going through. I was in the hospital several times because I couldn't swallow. Only thing they kept telling my mother is her tonsils is fine.
Wow.
We don't know what's wrong with her. I was in the hospital several times because I couldn't stop vomiting. At 12 years old, they diagnosed me with ulcers. At 12, what was I worrying about? My doctor who diagnosed me with Chiari Malformation was like, you should have been a doctor. You know so much about what's going on. That's because I stayed in the library my whole life trying to figure out. I knew something was wrong with me. My mother, my father, the doctors, no one believed me. In elementary school, I won every spelling bee, but the teacher told my mother I couldn't read. Something wasn't right there. How can I win every spelling bee, but you saying I couldn't read? So my mother took me to the doctors to get glasses. They gave me bifocals, but I couldn't wear them because I was struggling with these headaches. She take me back to the doctors a week later, and they was like, she got 20/20 vision. So I had all the symptoms all my life, but no one believed me. My sisters, you so phony. First is your ear, first is your eye, then is your leg, then is the, and it got to the point in my mind, I kept saying, it's in my head. In my head, I kept saying, it's in my head. So how I was diagnosed is being sick my whole entire life. My house burnt down. The Tuesday after Labor Day. I never know the date on that, but I knew it was the day after Labor Day. My house caught on fire. The walls exploded in my face. I hit my head. And after that, I thought I was okay. The insurance company moved me to the Hilton Hotel, Pikesville Hilton Hotel, and I kept falling. I just kept falling. Every time I stand up, I would fall. Get off the chair, I would fall. Go down the steps, I would fall. And I had one doctor who said, I believe you. It's something wrong with you, and I'm going to do all I can do to find this out. And that one doctor, and I am 50, be 52 next month. That one doctor who cared enough for me was that same doctor who said, you have something that's called Chiari Malformation. And I said to her, oh, that's a pretty little girl's name. Because I was diagnosed with so much that there's no way in the world you're going to tell me I have a brain disease. And she said to me, and this is how much this doctor and I was going back and forth. She said, but I'm going to leave out because I know you're going to Google it. Because at that point, I ain't believe nothing. They told me for 15 years I had asthma. I was so determined that I did not have asthma. I went skydiving, jumped out the plane 10,000 feet saying, I don't have asthma. 2 weeks later is when I was diagnosed with the brain disease. And then I was like, okay, whatever. Here we go again, diagnosed me with something else. I left the hospital, went to work, and I Googled this disease. And I started screaming at work. And I got sick so much at my job that instead of them asking what was wrong, call the ambulance, it's Val again.
No.
That's how much they called the ambulance. The ambulance coming in like, now what? So the first thing I saw when I Googled this disease was asthma-like symptoms, pneumonia-like symptoms, flu-like symptoms, problems swallowing, loss of vision, everything I was going through. And I started screaming, I got it! I finally found out what's wrong with me. So then I left it alone. 2 weeks later, I called the doctor because my doctor said to me, the one who diagnosed me, I never heard of this before.
Wow.
So I'm going to refer you to someone else. Whatever. 2 weeks later, I called that doctor. I made an appointment. And hi, my name is Val Jenkins, and my doctor, this is what the receptionist said. Oh my God, the doctor been waiting for your phone call. Like, he really needs you to come in. He want to do brain surgery. And I'm like, Park Heights coming out. Miss, you better get out of my face. Y'all not going in my brain just that fast. Y'all not going to do that. Y'all done lost your mind. I'm not going to do that. And she was like, the doctor want to speak to you. So he gets on the phone. What doctor get on the phone when you're trying to make an appointment? He get on the phone and he was like, Miss Jenkins, it's very important. You need to get in here ASAP. And I'm like, sir, I got a busy day, da-da-da-da. Made an appointment, went to work. It was like 12 o'clock. Went to work. I had a good day. I was in pain as I've always been in pain. I don't think I ever went without a headache. I just learned to live with it.
Right.
Yes.
So
Right.
I go to work on my regular day, which is a headache day most people can't handle. And I left. About time I got from downtown Baltimore to Green Spring, I walked in the doctor's office like, help me, somebody help me. I was burning. My fingertips was burning. My toes was burning, just that fast. I get to the doctor's office when I first met the surgeon, and he says, tell me your symptoms. And I don't know how it happened. As a grown woman, I can't figure out why my shoes was untied. I went to untie my shoe, and I vomited all over the doctors.
Wow.
And he was like, you need to go now. You need to go. All right, call the hospital. We need surgery right now. And I'm like, sir, it's not going to happen. You're not giving me surgery. So a week later, trying to skip over things, a week later, I end up passing out at church.
Wow.
And the paramedics came. I was already scheduled for the surgery, but the paramedics came. They rushed me past 2 hospitals to get to the hospital that I was having the surgery for. Talking about insurance, I have good insurance, but because of the insurance policy, once they realized what was wrong with me, it was a gap of time in between my surgery. The hospital actually asked me to leave the hospital.
Wow.
Maybe you could go and get something to eat. If I'm not mistaken, it was like 1 o'clock in the morning
Wow.
when they asked me to leave the hospital and then come back about 3 hours later to have the brain surgery.
Wow.
After I just passed out in church. I had the surgery. Everything was fine. 2 weeks later, I couldn't stop crying. Literally, I could not stop crying. Literally, I could not stop crying. I didn't know what was going on with me. And I'm emailing this doctor like, I can't stop crying. What is going on? The next day, I had an appointment to the hair salon. My mother came and got me, and I went to brush my teeth. And the water kept coming out my mouth. And I'm like, I done had yet another stroke.
Wow.
Thinking I'm having these strokes that the doctors keep telling me. And my mother, I was determined I was getting my hair done. 2 weeks, blood still in my hair, the whole 9 yards. By the time I got to the hair salon, everybody in the hair salon looking at me like that. Like, what are they looking at me like that for? My whole face completely twisted over.
It was like paralyzed, right?
Paralyzed.
Yeah.
But I could feel like strings coming from my face. But again, I don't know what's going on. Rushed me to the hospital. And I'm like, oh, it ain't nothing bad. It's just an asthma attack. Or I had a stroke and my arms start doing this.
Wow.
And they like cold blue or cold whatever they call it. And I'm looking around like, oh, what happened?
It's you.
It was me.
Yeah.
It was me that they was rushing. And on the way to the hospital, I'm like sending the text, like my face twisting. I'm like, I'm back on my way to the hospital. Don't tell my daughter because it's not important. And then they, cold blue, they rushing me back. I still got my phone in my hand. Call my daughter. I think this is important.
Wow.
I completely went blind and paralyzed.
Wow.
My whole face was completely turned. So fast forwarding, going through this 10 years now, 11 years, I now been diagnosed with 8 different diseases in my body.
Wow.
I had a Chiari Malformation. I have the spasticity, where my limbs completely lose control. I have narcolepsy, where I fall asleep. I now have the prolapse of the uterus, where my uterus just want to just do what it want to do, just fall out, push it back up, fall out, push it back up. I am allergic to all medication. All medication. I could go on and on. Bell's palsy, They diagnosed me with the whole 9 yards. And then in October of 2013, they said, unfortunately, it's nothing more we could do for you. I lost my eyesight. It would go this eye, then this eye, then this eye. And like you said, one day I'm like, hey, y'all, let's go and party. Hold that thought, I can't see.
Right.
Or if
Hey.
you do go and party, it's going to take you 3 days to recover.
Exactly. Exactly.
And party might just be like a trip to Target.
Exactly. Exactly.
The
So-
fatigue is
Yeah.
Horrible.
for the lack of a better word, is amazing.
Yeah.
Because sometimes you have the energy of a bull and you can run laps, and then other times you don't understand why you can't walk from the bedroom to the kitchen and not be absolutely positively exhausted. I work from home, and sometimes and I now have FMLA, and I can wake up at 5:30 to get myself together, and I don't have to be to work until 8 o'clock. And it's hard explaining how you can wake up at 5:30, between 5:30 and 6 o'clock in the morning, and then by 8 o'clock in the morning, you have to take an FMLA day because your feet and your legs have swollen and you don't have enough energy to sit up, or you're in that much pain that sitting up is just not an option because you just need to lay down. And because we do not look like what we're going through, it is so hard to explain that how in a matter of minutes or a matter of hours.
You so phony,
we go
girl.
from
You was
one-
just doing this 5
Yeah,
minutes
You
ago.
go from one
It's feeling
extreme.
great.
You go from one extreme to the next, and it's the most frustrating thing in the world, because it's not as if. And I tell people all the time, if a person with Chiari Malformation tells you, "I can't," that is because they really and truly cannot, because they have tried everything in the world possible to get done what they want or what you've asked, but they literally don't have the energy to get done that very thing. It's just no way,
Mentally,
yeah,
mentally or
physically.
physically,
Or
Yeah.
physically.
just do not have the energy to get it done. And I may physically look like, oh, okay, I'm okay. But what is going on the inside of me is absolutely unbelievable. Sometimes my temperature control, I'm the only person in the house that is
I'm sitting
sweating.
here now.
Me too. I'm
sitting here
hot all the
freezing,
time.
but I have to eat ice. It's crazy. Or I'm burning up. It's burning up, and I don't want to drink water at all.
Yeah.
So I Googled this. Y'all go hear me say Google all the time. I say Google is my fiance because he give me everything I want. He be like, hey. So I Googled this last night. And if any one of y'all went through this, just a raise of a hand. Headaches. Dizziness. Difficult sleeping.
Oh.
Both
Can I
hands
stop
up.
you right there for 1 second?
Yes.
Sometimes depends.
For
on
the last 16 years, nobody knows this. I have not been able to fall asleep without taking Benadryl,
You and I had
Tylenol
this
PM,
conversation.
Goody Powders PM, Z-Quil, anything that would make me sleep. I've never.
And the blessed part,
I
none
can't.
of us are crackheads.
None of us.
Right.
No, I don't take nothing else.
Right.
But never been able to fall asleep on my own for the last 16 years.
Well, I can
I
fall
just have
asleep.
never fall asleep on my own.
Right. So
I
let me
can fall
go through
asleep.
this.
I'm going
Yeah.
through a period now where I can fall asleep, but I can't stay
Stay
asleep.
Stay asleep.
Yep.
Okay, so weakness of the arm and the hands. We all said that. Neck pain. Numbness, tingling in the arms and the hands. And remind y'all, I do hair. So I did hair for 3 years and couldn't feel my fingers and toes. Fatigue,
Yeah.
nausea, shortness of breath. Just today, as I was doing hair, I was like, I can't breathe. Like, and I'm like, back in the day, I would have grabbed the asthma pump to find out I never had asthma. Blurred vision. We all know I lose my eyesight all the time. And the wild thing is the doctors couldn't figure out why I kept losing my eyesight. So they sent me to a major hospital, and to deal with the attitudes of the doctors, He yelled at me and said, "Why did they send you here? This ain't a vision problem. It's a neurology. Like, why are you yelling at me?"
Right.
Right.
Yeah.
So, difficult swallowing, we all said that. Leg weakness, we all said that. Abdominal pains, of course I dealt with that. Balance problems, we all diagnosed with falling.
Sometimes.
Yeah.
Body weakness,
Yeah.
chest pains.
Sometimes.
A little bit.
I don't think
Every
I
once
ever
in a
experienced
while.
the chest pains.
I have PVCs, premature ventricular contractions, so that's the only time I get it. But
Wow.
who knows what that's related to?
Depression.
I've suffered
Yeah.
from that.
Anxiety.
And definitely anxiety.
Yeah.
I with anxiety, I think I've been through so much that I've been through so much, and I've personally experienced 3 suicides that I'm very, very particular on using the word depression. So I'm determined that I'm not going to ever put myself in that whole situation, me personally. Facial numbness, that face going over. Hoarse voice,
Yes.
we
Yeah.
said that. Leg and foot numbness.
Yeah.
Memory problems.
Yes.
For this is why we here today, because I lost my memory for 2 hours and 17 minutes just last week. Slurred speech. When I was rushed to the hospital, and when I came through, I looked up and my whole entire family there. I was like, did I die and go to heaven? Like, what happened? But what scared me was I was like, yeah. And that's what scared me. Like, why am I talking like this?
I trip on words. It's like I
Yeah.
hear them, I know what they are,
And you want to speak
but
them,
getting
but
it from
doesn't
here
come
to
out.
here and coming out correctly does not always work.
I've
So
been
let me
to a
ask
speech
the-
pathologist
Let me ask the
a few
doctor
times.
real quick. Some of the symptoms, like the slurred speech and stuff like that, I haven't experienced, but I've had to.
Just wait for it, boo. Just wait for
But
it.
I've had it since I was, I guess I diagnosed, but I've had it since since I was like 13.
Right.
So probably about a good almost 30 years that I had it before I got a surgery, but I never experienced anything like that. Now, I mean, I understand that there are different levels of Chiari,
Right.
but what would be the instance that the majority of them may have had some type of slurred speech, but I've never really experienced that before.
Yeah. I mean, it's a great question. It seems like, there's a multitude of symptoms that a lot of people share. Some people are going to get certain symptoms, some people are going to get other symptoms. We have to remember there's 3 types of Chiari malformations. You may not all have the exact same kind. You may have different levels of herniation, so your cerebellum may be a little bit deeper. You may have a little bit of the cyst on the spinal cord, the syringomegalia, like you were talking about, JJ. There's all these different variations, and you have nerves that come out from your brain called cranial nerves, and they're the ones that give you, you go to your ears and your eyes and your throat and your tongue and your speech. So a lot of those nerves, cranial nerves, can be affected by the various levels of herniation. So everybody's picture is going to be different. So some people are going to have it, some people worse. Some people are going to have some relief from some symptoms with the surgery. Some people are not going to have those exact, reliefs from certain surgeries or certain medications. So it's all kind of nebulous, right? It's all kind of cloudy. But I think what the overall theme is that, you all have some varying level of problem, and a complex syndrome of different types of symptoms. And so it's just about finding what works for you and how you can, get those relief from some of those symptoms.
So they-
As a medical professional, what advice would you give your colleagues when someone presents with all of these symptoms that they're familiar with but unfamiliar with
the disease.
to sit down and listen to what the patient is telling them? Because for me, it's a double-edged sword. I'm a nurse as well as a patient.
Right.
So it's frustrating as a nurse to hear and see so many people going through some of the symptoms that they're going through and hearing them say, nobody will listen to me. Because we as medical professionals, we're taught that what our patient tells us is subjective.
Right.
So if what they're saying is subjective, that means that it's real to them.
Right.
It may not be real to us because we can't see what they're going through, but it's real to them. So how, as a medical professional, can you advocate for us as patients? Because the way that I got diagnosed was as a patient as well as a nurse. I had to advocate for myself to get an MRI.
Right.
Because the doctor was just going to give me medicine and said, see you in 6 months. And I said, no, we need to do something else other than what we've already been doing. Something's wrong. I don't know what, but I do know that something is wrong. And being a nurse and working for the company that I work for, in a staff meeting, I finally said something one day, and one of our executives, she allowed me to speak about it, and she said, you know what, that's amazing. I've never even heard of that before. And the funny thing about it was, she then sent me an email and said, it's a priority for me to educate other executives on this very thing, because we may have other employees dealing with the very thing that you're dealing with, and we need to know how to support what you had. Then I started getting emails and getting contacted by other employees that were Chiari Malformation patients, as well as having other neurological disorders, and finally feeling like somebody is listening. So we are visible, but yet still invisible, because we don't want pity, we want help.
Right.
Right. So thank you for sharing that story. That's really amazing. And I'm hearing kind of a common theme here is that you had these symptoms, you had these kind of things bubbling up, some vague symptoms. Just because you have a headache doesn't mean you have Chiari malformation.
Right.
But when you keep having headaches plus this, plus that, plus this, plus this, then, and you have to have a physician or a provider who's listening to your entire picture, right? Looking at you and your holistically. Because if, you're just seeing one symptom, it's not like I'm going to get an MRI. But if you're telling me you have some of what we've been identifying as these kind of red flag symptoms, so, the numbness on the arm, that comes out of nowhere, those are red flag symptoms. The severe headache, like worst headaches of your life kind of thing. A lot of these are red flags, so you should get seen right away if you have these problems. And that's what I would recommend, especially to your viewers and listeners, is that if we can put together a cluster of all these symptoms, and it's looking like something is going on neurologically within your brain, then I think it's worth having a conversation and talking with your doctor or your provider about getting some imaging of your brain. And an MRI it's the best one, but it's also the most expensive one, as we know. So, usually we don't want to just like order MRI for everybody, but if you're putting together all these symptoms and a physician is listening to those, and if someone came in and had those symptoms to me, I would say, yes, I think we should get an MRI. Let's figure out exactly what's going on.
It's wild when you said MRI. As I stated, they diagnosed me with asthma. And each time that I went into the emergency room for a quote-unquote asthma attack, is the lack of oxygen to your brain, they gave me an MRI. So why, after all these years, no one never saw this issue? And it was more frustrating to me because I had the attitude of fighting back. And the doctor be like, oh, you got the red, white, and blue disease. And I'm like, nope, I don't have that neither. But I know I have something, and I'm going to find a doctor that will figure out what's going on. So now the doctor is looking at me like, Huzzy, I'm the doctor. So they not giving me as much attention, right, because I got this attitude that I'm going to find out what's wrong, and you're not going to tell me anything. With the spasticity. I had to tell them what was wrong. Right. And most of the things that I went through, I had to tell them what's wrong. Growing up as a female, and I must say shapely female, dealing with the sexual appetite, I should say, dealing with that. So when I go to my doctor, the surgeon, and the doctor and say, is this my hormones related to this brain disease? This doctor literally said, it's no way in the world. One thing don't have nothing to do with the other. With an attitude.
Yeah.
With an attitude. And then the other doctor in the room listened to me. And she was like, why did you say that? And I told her why I said that. And she literally called me back and said, you hit it on the nose. You have something that's called sexual headaches. And when I try to explain to people, and you correct me if I'm wrong, when I try to explain to people is to look at a normal person, basically their brain is like this. Our brain is like this. You got the whole, and I'm not even that intelligent to use the medical words. And most people who listening is not even that intelligent to know what the medical words is. So I'm gonna use my PhD, which is my Paul Kitts degree, and I'm gonna explain it the best way of my ability. So most people's brain is like this. Our brain is like this. You have the hole right here in the back of your neck. Our brain go in here. So when I explain it to people, I mainly use a man because most people are visual. So women can sit here all day long and say, no, my hormones is not on fire. But a man can't because the penis erects, right? Am I wrong? So the blood vessels makes it swells, right? The hormones flare up. So you got the brain inside of here with the blood vessel and it's fighting for room. So what happens with me is when my hormones flare up, I'm like this. I literally cannot lift my head up off the bed. Or I lose my eyesight and it's always on the right side. I lose my eyesight in my right eye. Or I can't feel my fingers go numb. And dealing with this brain disease and the quote unquote 8 diseases that I have in my body, I can always tell what's going on from what part of my head that's hurting.
Right.
Yeah, so dealing with that. And who do you talk to when your doctors don't want to listen to you?
Can I say something about that? I think that it used to be seen as a really rare condition.
Yeah.
And it's not. So what you said at the beginning of this is I think a lot of people have this, and I think that's the case. I think it's just rarely diagnosed well. To fairness to the medical professionals, I don't think it's covered well in schooling. I've been told by many doctors they spent like a half afternoon on this topic. And so we're just now starting to see people in the medical field become experts, if you will, on Chiari. They're few and far in between. And that's why we get told it's unrelated. That's not related. It's why it takes so long to diagnose the Chiari, because it's just not really commonly talked about. So I think it's great that this is happening. Right. And I think it's great. Like, we have to really educate. You said that too. Like, I had to tell the doctor what it was because we're living with it. We have to educate them so they can learn about it and help the next person that comes in with all these symptoms. Oh yeah, I had a patient like that. I better send this person for an MRI.
And to piggyback on that, unfortunately, with that, we're in so much pain all the time. We're seen as drug seeking instead of
I don't want another pill.
chronic
Just
pain.
fix me.
Right.
Thank God for Thrive.
We're seen as drug seeking.
Yeah.
And it's not that we're seeking drugs. We're seeking a way out of pain, relief. And it's not that we want medication. Even if it's something that is natural, give us something that's going to get us out of pain, because we don't want to become addicted to anything. Right. We just want help so that we can live a normal life.
So okay, go ahead.
Because it's funny you said something about like sexual headaches. What was that?
Go ahead,
but it was funny that you said something about sexual headaches, because I've experienced that before. Like now, and just coming to think about it, it's like that's probably when I lose my vision. Like, you know, like right before like the climax, you can feel it, and then it's like you want to just stop, because if you keep going, it's like you want. It's like you gotta just lay there and be like, oh, I can't even see, and I got a headache. Let me just lay here.
Right. So unfortunately, our time is up, and this has been amazing. We have to do a part 2 on this, because like it's funny because neither one of us knew each other before this brain disease was presented to us. So now we're so close together, we have the same symptoms. Sometimes we all have the same symptoms at the same time. So we're going to bring this together. I want to give a huge thanks to each one of you. I want to give a huge thanks to Dr. Bruno But guess what? We could not have done this without Diamond K from Radio on Fire. So we want to give him a thank you for this. And we got to do this again. And we need to bring this and push it and push it and push it. So again, my name is Val Jenkins, and I want to thank each one of you guys for coming. And it's not in your head, regardless if it's in your head. Thank you.
Yes, it's great.
That was amazing.